Day 26 of Learning Exercise Therapy. A therapist examines a patient's status, post traumatic brain injury. Then, examining neurological tone, the most appropriate method is answer, passive range of motion of the involved and the uninvolved extremities. A therapist completes a developmental assessment on a 3-month-old child. Which reflex is stimulated by the head suddenly dropping into extension? Answer, Moro's reflex. When treating a patient with hemiplegia in tall kneeling, which treatment technique will be the least effective? Answer, straight plane motion with the unaffected arm. A physical therapist, 1-month-old infant, during the treatment session, the therapist strokes the cheek of the infant, causing the infant to turn its mouth towards the stimulus. This action best defines the dash reflex. Answer, writing reflex. A therapist performs upper extremity passive range of motion exercises to a patient with an IV connected to the dorsum of his right hand. During the treatment session, the therapist notices a small amount of blood which has backed up in the IV line. The therapist's most immediate response should be answer, reposition the peripheral IV line. A therapist examines a patient referred to physical therapy diagnosed with peripheral vascular disease. Which of the following will be the most valid indicator that the patient is not a candidate for an active exercise program? Answer, decreased vital capacity. A patient's status post-spinal fusion is referred for chest physical therapy. The therapist instructs the patient in diaphragmatic breathing exercises. Instructions are given to the patient to place his dominant hand over the mid-rectus abdominis area and his non-dominant hand over the mid-sternum area. As the patient inhales slowly through the nose, the therapist encourages the patient to answer, direct the air so that the dominant hand rises during inspiration.